Good afternoon, everyone, and welcome to our webinar, Take Action, Implement Workforce Diversity Strategies to Effectively Address Disparities in Mental Health. We certainly appreciate you joining us today. I'm seeing on the chat box that we've got folks joining from California all the way out to the East Coast, and we know we're spanning several time zones with that, so appreciate your taking the time to be with us today. We just want to share that equity is a strong focus for the Pacific Southwest Mental Health Technology Transfer Center. And so we're excited to share some strategies with you today, as well as learn from you. So as we noted in the description for this webinar, we're going to be asking you to share tips of your own success in this topic area, and we're going to collect them and summarize them into a tip sheet that we would love to share with the field. We've already started a draft of that and look forward to maybe getting some new ideas from you as well. So on the next slide, you will see that the views and opinions and the content of this do not necessarily reflect the opinions of SAMHSA. And before we dive into introductions and the topic, I just want to share with you that this webinar is part of the Pacific Southwest Mental Health Transfer Technology Center, or the MHTTC. It's a collaborative effort funded by SAMHSA to support resource development and dissemination, training and technical assistance, and workforce development for the mental health field. I think I'm supposed to be doing slides, so I will now do that. Or Annie, if you could do that, that would be awesome. I'll switch off with you. My colleagues Annie, Saganya, and I are serving this region that includes, as you can see on this slide, Arizona, California, Hawaii, Nevada, and all the U.S. Pacific Islands. And as you can see also, each of the areas of the U.S. is affiliated with, is in a region that includes technology transfer centers that support the workforce for addiction, for prevention, and for mental health. On the next slide, you can see our role and our primary goal. We do offer free training, TA, and resource dissemination to support the mental health workforce. There is a focus on evidence-based practice, and I will say that for our center, we also want to make sure we're lifting up culturally appropriate mental health services as well. And these are the different services that we have available through our center, and I'll talk a little bit about that more at the towards the end of the session, just to share some regional training opportunities that we have, as well as coaching and consultation. So I'm going to have Annie introduce herself as the co-presenter today. First. Annie?
Great. Hi, everyone. My name is Annie Van Dan, and like Rochelle was saying, we're based here in Denver. And I wanted to share a little story about just workforce diversity, my own experience prior working at a refugee health clinic in Colorado. The clinic would see patients who spoke over 40 different languages. So as you can imagine, it was a very diverse patient population. And so the staff was reflective of that. But even with the diverse staff, there was still a lot of training and knowledge that we needed to do and share amongst ourselves. So for example, I was born in Taiwan, and a lot of times people would think that I was Taiwanese, and if a patient would come in and needed Taiwanese language services, they would ask me, and I'd have to kind of explain like, oh, I'm Chinese and I speak Mandarin. And that would also come up with when we were serving the Burmese community. We had patients that were Karen versus Chin, which are very different languages and different ethnic groups within the Burmese population. So even within such a diverse staff serving a diverse population, there was still a lot of training and education we needed to do amongst ourselves.
Great, thank you for sharing that, Annie. One of the things you'll notice throughout this webinar is that we're going to do our best to try to share experiences or examples or practical strategies for you as we go through the content. So my name is Rochelle Espiritu. I am the co-director for the MHTTC in the Pacific Southwest, although I am based in Denver. My background is in clinical psychology, and I'll just share that I'm really passionate about creating spaces that are not only diverse, but also inclusive and striving to achieve equity. The story I wanted to share with you was, and the community builder for this is actually I wanted to ask you this question for you to just reflect on the spaces that you've been when you were in school. And so if you feel comfortable sharing in the chat, what grade were you in when you first had a teacher who looked like you? And I was thinking about that this morning because I was reflecting on the fact that I had my first Asian teacher when I was actually in college. I had grown up going to school in the States, but I did not have an Asian teacher until I was a freshman at the University of Colorado at San Diego. And her name is Yen Espiritu. So she even had my same last name, which I was just so fascinated by. But she was Vietnamese and had married a Filipino. My son had his first Asian teacher earlier than I did when he was a freshman in high school. And I just remember what it was like for when he had this teacher and how he was so much more engaged in that class. I actually heard stories from him when he would come home from school and tell me something his teacher said. And so I just think about these spaces that we're all in and how different it feels when you have other people that look like you, that you might share some cultural background or experience around, and how that just makes you feel included in a whole different way. And so, as we thought about that, we wanted to bring that kind of same feeling of diversity and inclusion and think about what would that mean in the mental health workforce. So I want to thank folks who shared their experiences. So we've had somebody who had their first teacher who looked like them in first grade, or I was even going to say you might go to preschool or to kindergarten as well. Someone who shared that it was more towards middle school or in junior high. And so just an interesting thing to reflect on as we talk about diversity and inclusion in the spaces in which we live, work, and play. So Annie, I'll pass it back over. So we have a couple of objectives for our learnings today. We want to talk a little bit about what workforce diversity is and why it is important. We're going to identify how to assess workforce diversity. And in your settings, you might already be doing this. And so we'll be curious to hear from you about what strategies you've taken around that. We'll determine how your organization is doing in each performance area. I've uploaded a tool that you can use that has a series of questions that you can consider. And then we'll explore different aspects to assess these areas in workforce diversity. And oftentimes we think about it as just hiring, but we'll be kind of expanding the way that we think about that. The tool, as I mentioned, is on the handout side. It's a self-assessment instrument that helps you assess where you are as an organization and how well positioned you are to successfully implement strategies as well. So it looks like we've got...
Sounds good. So the agenda is just going to reflect our objectives, and we want to have the practical strategies as well. So we will spend quite a bit of time on the second half of the webinar sharing strategies as they pertain to the organizational performance areas. The first few slides will talk about what workforce diversity is and how to assess it in your organizations. And then the reason why we titled this webinar Take Action is we wanted to provide you the tools and the know-how to be able to start making changes to diversify your organization. So we know that a lot of times we're in positions where we feel that we aren't able to make change, but we hope that this webinar at least encourages you to start the conversation. Because you never know if one of your ideas, something you saw or an idea that you have, can make change for the better, and it can lead to a new policy or even a much larger structural change. So the next slide, is that we're just going to jump into the definition of workforce diversity and why it's important. And before that, we'd like you to type into the chat box, why do you think building a diverse workforce is important, especially in mental health? And then you can also share how it is you define workforce diversity. Let's take a moment here.
I'll help you read those off if you want, Annie.
Sure. Okay, so again, why do you think building a diverse workforce is important, especially in mental health? And I'll just move on to the next slide. So what is workforce diversity? When we talk about a diverse workforce, we don't just mean in regards to race and ethnicity. Diversity goes beyond a diverse racial and ethnic makeup of the staff. We're also talking about different faith, gender, age, sexual orientation, past experiences with occupations, other aspects of the human condition further enhanced by our cultures. So in this webinar, we want to talk about diversity also at all levels of an organization. Some organizations do a good job of having a diverse frontline staff. So for instance, the receptionists of the office. But we are talking about having diversity at all levels, from your boards to the administrators and the clinicians. Because what happens is people of color are often hired for entry-level positions, and then the HR will say, well, we've hit our numbers for diversity, and this is where the concept of inclusion is important too. So we would like to see diversity in leadership positions as well. And also that some of you may have heard this quote before, but it is diversity is being invited to the party and inclusion is being asked to dance. And so what this means is that a person is made to feel welcome and confident to contribute in the spaces that they're in. And they're not just invited there to be a number, which we would say is tokenism of having more people of color on your staff, just for the sake of having the numbers. In recent years, a problem often is that diversity and inclusion are used together so much that people start thinking they are the same thing. And so without inclusion, though, we wouldn't have the critical connections that we need that attracts diverse talent, that encourages their participation and fosters innovation. And this also leads to good business growth. This next slide shares a bit about why a mental health workforce diversity is important. So the two sides here. So mandates such as the requirement for care to be delivered in a culturally and linguistically competent manner. Diverse staff also allows your organization to stay competitive, as you will be able to provide more services to diverse populations. Organizations that embrace the values of cultural competence as well, they're positioned to do well in the current and future market. Implementing cultural competent service delivery systems can also positively impact provider recruitment and retention, patient access to, and satisfaction with care. Additionally, the ability to communicate well with patients has been shown to reduce the likelihood of malpractice claims, and conversely, lack of awareness about cultural differences and failure to provide interpretation and translation services often results in liability under court principles. So once you've been able to make the case for diversity, then it's easier to get leadership and staff on board, because then everyone can agree that this is good for the bottom line and that we need to invest in diversity to improve our outcomes. So then you move to the right side, the fact that having diverse staff is the right thing to do. With the demographic shifts, we need to understand the different cultural beliefs and perceptions that our patient population has in regards to illness, disease, and mental health. Understanding differences in culture, language, health, and mental health beliefs of both providers and patients can help improve the care and lead to better health outcomes. Generally, it has been shown that health outcomes improve when providers are more closely reflecting the population that they are serving. And unfortunately, there is a shortage of physicians of color in the US, and they are the ones who are more likely to see Medicaid and uninsured patients. So the federal government has estimated that more than 60 million Americans are living in primary care areas that have primary care health professional shortages. Culture affects our preferences about how care is provided and by whom. Many patients prefer a provider that shares commonalities, such as the provider speaks the same language or shares a hometown. So the story I'd like to share here is I have a Vietnamese American friend. She is a school counselor and works in a school predominantly of white students. And she said when she began working there, she noticed that right away all of the Asian American students wanted to start scheduling appointments with her. one of the most common issues she heard from them was the pressure that they felt to do well in school from their Asian parents. So this was something she could really relate to, having experienced that on her own. And so many of the students were excited to have an Asian American counselor start at the school. She was the first one in the history of the school. And they felt like she was a trusted figure that they could confide in, that could relate to their issues and their challenges they were.
We're going to move into how we get started. So as we talked about earlier, like this can start by anyone, right? You don't necessarily have to be in HR or in a leadership position, but we wanted to kind of make this accessible for everyone. So what we encourage is that you've really made sure that you have the time, resources, and you've created the climate to do an organizational assessment of workforce. And this is just an overview of the process. So at the very beginning, first you need is to make a commitment to do this. We know that commitment is great when it comes from leadership. It doesn't always. And so think about how you might want to approach that. This process requires some self-reflection and awareness and a willingness to change and to grow within your organization. So it's really important to think about who's going to be involved. And convening a team that represents all levels of the organization is helpful, right? So invite team members that could potentially complete this assessment tool or another tool that you might have together. You want to make sure that the leadership is important and that HR is involved, but getting diverse perspectives from folks like your clinical folks, support staff, administrative is crucial. Also, you might consider engaging your board or an advisory board, which may include community members. And so you want to make sure you also have a good cross section of other folks in terms of different racial ethnic backgrounds, people who have been with you for a while, newer staff, people with lived experience. So just encourage you to bring together a diverse team. Next, you'll need to identify and allocate resources. And by resources, we don't mean just money. Again, we're talking about things like time. Like it might mean that you are going to take some extra time either during the day or when you're not running programs to do this work. Again, you'll need the people that are engaged. And then you'll also want to make sure you have space and respect that maybe you might need to pay people extra for their time, depending on who you've chosen to engage in this process. And then you'll want to make sure you're communicating the importance of workforce diversity and why it matters to your organization. There might be some fears that emerge. Sometimes staff worry about implications for their own jobs, maybe. So again, with any change process, you must over-communicate the vision and the process that you're expecting to go through with this. And then finally, you'll go through a review of some sort. We've offered a tool and process for assessing, such as the one that the MHTTC created, but there are also other tools that are out there. And if you have questions about those, please feel free to reach out to us and we can help you identify those. When you're getting started, you'll want to think about whether or not you're going to do this together. Like maybe you'll have people do it on their own, or you might decide to do it as a team. But so there are just different ways that you can approach this. And we want you to keep in mind that with any tool or process that you're using, you're not like looking at an absolute answer of whether yes, you do or you don't have something, or you're doing great or you're doing not great, but rather just consider that this is all a journey and that you're probably on a continuum. And so you'll be wanting to just look at the extent to which you do have things in place and where you can make some changes. So the guide also offers multiple pages of resources on being able to diversify your workforce. They're listed by topic, so you can locate a resource and review it as you begin the work. And we've also included a glossary of terms that we're using in the development of this work. So you might even have a conversation with your teams about shared language and work on building definitions that resonate for your staff, because you'll want to make sure you're all on the same page. So when you talk about diversity, what do you really mean? Like make sure that everyone's on the same page. And then What's nice about this tool is then we offer space for you to identify action steps to address the areas where your organization might be more on the beginning side, and how you might incorporate those into an existing organizational plan that you might have. So now we're going to go ahead and talk about the performance areas that you'll want to look at. Move us along here. So there are different ways of looking at workforce diversity and thinking about organizational structure and linguistic competence. So as we said earlier, workforce diversity is a much bigger commitment than just hiring and retention. It really does involve different aspects of your organization. And while there are these common elements that we have up on the screen, we recognize that no two organizations are going to look exactly the same, because you'll have different service populations and needs. And even if you work with the same populations, your staff makeup, your organizational culture, and how you approach staff interaction and program implementation and working with the community are going to differ slightly. So if you think about organizational culture and workforce diversity, to some degree, they're like different personalities that we all have. So we're going to go through each of these 6 performance areas. And after each of them, this is when we're going to ask you to share stories or examples or suggestions for things that have worked well for you, or even not. I think sometimes we learn best from our failures. So if you're brave to share one, feel free to do that. We'd love to learn from you and with you. So we're going to take a look at these. It's governance and leadership, which is kind of the development and oversight of strategic directions and plans and policies. Workforce development is about how we engage people in an organization. The community engagement and partnership, so how we outreach with other partners. Adaptation of services and supports, communication and language supports, and continuous quality and accountability. So these are actually adapted from the class standards, but what we're going to do is look at different aspects of this as it relates to workforce diversity. All right, so let's dive deeper into governance and leadership. So when you have a fully committed leadership and governance body that ensures workforce diversity, this could and should be a guiding philosophy within your organization. And that would show up in the sense that you would have strategies that support workforce diversity and are integrated throughout all levels of the organization, from like needs assessments and planning, policy development, decision making, and program implementation. In addition to your leadership and governance, sharing the responsibility with HR for ensuring workforce diversity, it's also important to look at your own leadership to make sure that they are diverse, because this can really help set the tone for the organization, and also for the staff and the potential new hires from different groups, different racial and ethnic groups. And when folks can see that reflected in the leadership, they see more potential for upward mobility if they see themselves reflected in leadership positions or on the board. Your board, that's also another great place to include consumers and community members who reflect the population you are serving. I was just at a training in Monterey last week where one of the participants shared that they have an organizational policy that their organization represents the demographics of the population they are serving within 10%. And so, we talked a bit about like, what did that look like? How did you get to that point? And, and even making that commitment to that was a big step for that organization, but they've been able to do it. They're in Southern California. They had might have had an easier time doing that. But for an organization to make that commitment, I think sends a strong message to the rest of the team and the organization as well. So we'd love to hear from you. Like, what are your experiences, your stories, your examples around leadership and governance that have worked well or not? Or do you have examples of policies or things that you've done with your boards that have helped to support workforce diversity and inclusion in your organization? Danya's Type that in and would love to hear from you. This is also a good time, as people are typing, to revisit your vision, your mission, and your values. Oftentimes, those kind of sit on a website or they haven't been viewed from a lens of equity. And so, when you're hiring staff or people into your organizations, it's some people will really look for that. And if you have that up in front and center, that's a lot more meaningful for folks too. Okay. Um, all right. We're not getting any chats in there, so we'll move on to the next one. So this is around recruitment. So finding and hiring is often a challenge, right? It's one where we hear organizations saying, like, well, they're just not out there. The people from who represent the community we serve, we're just not even getting resumes or even applications from folks. And so, how do we move forward from this? There are a lot of things to consider in recruitment. So I'm going to start first from even considering how you're writing your job posts. So one of the strategies from our tip sheet is on writing equitable job posts. We'll share that out after the webinar. But this means things like maybe disclosing the salary range in your job posts. I know some of us tend to not want to do that. We say it's commensurate with experience, but asking for salary actually hurts people of color and women who historically have gotten paid less for the same work done by white men. Also, do you lead in your description? Do you lead with a vision of equity or values of diversity, inclusion in your job post? Or is it an afterthought, or maybe a standard equal opportunity statement that we all put at the end of the job announcement? Like, what would it look like if that was a lot more front and center in the job post and description that you put out? We also think that valuing lived experience and competencies is really important when you're thinking about diversifying your workforce. You might be looking at accepting equivalent experiences instead of formal degrees for the kind of work that you're looking for. So you might really want to check and see, like, is it really required that this person have a master's degree or some kind of advanced degree in order to do the work that you're hiring for? We know that our educational system is inequitable, and leaves many people behind. And there's so much great experience that people come with without necessarily having the formal degrees. We do know of an agency that has taken some more tiered approaches to gathering information. For example, first they ask applicants to respond to a series of questions that can be done in either written form, or what would it look like if it was done in an audio recording or a video recording? And then they ask for the resumes to review later on. So that's just some food for thought to think about how you're doing your recruitment. The other important piece too is to think about who you have on your review committee. So as you're putting that together, you might want to honor the perspectives of a diverse team and have that reflected in the review committee. One thing we'd note is just to be aware of tokenism while you're building diversity in your organization. We did hear from some state folks last week how one woman was sharing she was working for the state, and she was the only Black woman in their department. And so she was being sent around to all the recruitment strategies happening up and down California for a while. And it took them a while to then build diversity in their teams such that she wasn't the only one doing that anymore. So just some things to think about. The other consideration is where you're posting your jobs. So if you're posting on traditional networks like Indeed or LinkedIn, you will probably get traditional applications and maybe not the diversity that you're looking for. So again, when we think about time and space and effort, dissemination of these kinds of announcements takes a lot more outreach to special interest groups, to maybe ethnic magazines or newspapers, into maybe ethnic radio slots. I mean, so really knowing your community demographics and how they receive information is super important. So again, we'd love to hear from you. Are there different strategies or successes that you've had when you've been doing outreach in order to recruit a more diverse workforce? So please do share those ideas related to recruitment, because we'd love to add in more thoughts into this section of the tip sheet. Or if you have questions for us, and I know there's some chat going on the left that Saganya is responding to, but feel free to send questions as well. We will go ahead while you're typing in. You see some folks are typing in, so please continue typing in thoughts on recruitment, and we will move on to the next slide. Back to you, Annie.
Okay, sorry about my internet connection. So I've called in, hopefully you can hear me better. So this next one is onboarding, orientation, and ongoing training. The overview of it is, does your organization provide culturally responsive onboarding, orientation, training that ensures that new staff can get acclimated to your culture and your climate? And is the training designed to increase their ability to translate awareness and knowledge of equity and diversity and put that into practice? So some examples of what this might look like is orienting new staff to the culture and climate in culturally responsive ways. For example, from the very beginning, if you're doing a walking tour of your office for new staff members, do you make the process welcoming for someone who has different mobility levels? And do you demonstrate cultural responsiveness and appreciation, such as offering accommodations to address a person's special needs? Is your organization considerate of the different cultural dietary preferences if there's refreshments offered during the meeting? Does your organization do any cultural training or orientation about the populations you serve, about celebrating and recognizing differences in general? So some of those questions, we would love to hear if your organization is doing any of those things. Some other ideas are, you can be doing actual trainings in person through meetings and workshops or videos. And another way this looks like is allowing people to shadow staff, attend and participate in programs that you run with community members. One example of this is that in Colorado, the Public Health Department, there is a mandatory health equity training that all staff must take within 90 days of working there. There's a committee that updates this training. It's the Health Equity Environmental Justice Training. It oversees what this training looks like, and it gets updated every year to have new content that is relevant and up to date. So wondering if any of your organizations do anything like that, offering like mandatory trainings related to equity. And again, it is important to keep updating, because I have been a part of organizations that have very outdated trainings that they've been just doing for their onboarding or their orientations for a very long time that just aren't as relevant. And also organizations that say that they are on board for diversity and equity, by having these trainings really show that they're invested in this from the moment you start working there. The next slide, we're going to talk about retention and professional development. So professional development opportunities ensure that staff have pathways to grow, they are getting promoted and are satisfied with their job. One of the risks about professional development often is that we're afraid that once you've really supported a staff member that they will leave your organization. But we should be really looking at it that it is success if an individual that you've been helping and supporting feels confident enough to move into another setting. And in the chance that they stay because they really love the opportunities that they have with your organization, then you have really developed a future leader for your organization and using this inclusive tactic. Oh, sorry, I think I got kicked off the webcam, but I'll continue by phone. So another aspect of this is to create a climate of transparency, and that's one that fosters diversity and inclusion where staff feel supported and valued, a feeling that you have their back, so that they can go to leadership and feel that there's an open door policy, that there won't be repercussions if they want to share something to leadership, and that they are supported.
Annie, your computer might still be on by audio, but we can hear you.
Okay.
Okay.
I'm hearing an echo.
Yeah, can you mute your computer? Or just turn off the sound on it?
Yeah, it is muted. That's weird. Okay, maybe.
I think you're okay now.
Okay. Okay, yeah, I had to mute the speakers. Okay, so another aspect of this is to promote an expectation, not just that staff approach the community members with respect, but also that community members treat staff that way too. So often we will say that, the customer is always right, for example, and so the staff gets treated very poorly. But if we promote that expectation, then community members also must treat your staff well, and that allows, that will have a higher likelihood of your staff to stay because they feel that they're supported in the decisions that they make when working with the community. Another example is if the population you serve regularly visits natural healers or relies on family members for professional advice, then you could invite these natural healers to do training with your staff and even conduct some programs at your organization. Your organization can also hold support groups, events, or other activities that make family members of the staff feel welcome. One challenge to keep culturally and linguistically competent individuals is also legal status. Organizations have shared that to retain these individuals, they can help them establish permanent residency and working visas, and also provide training programs that are specifically tailored to these individuals. Some organizations have mentorship programs that provide staff a sounding board and support system. Additionally, not all organizations can do this because you really need more representation, but to provide employee resource groups or ERGs, these are voluntary and employee-led groups that foster a diverse, inclusive workspace for people who have similar backgrounds or interests, and they can come together and support each other. Benefits of the ERG groups include the development of future leaders, increased employee engagement, and employees feeling a sense of belonging. Your organization should also value those with lived experience and encourage them to bring those experiences forward. For example, hosting lunch and learns and allowing staff to share their own experiences with other staff. Bringing people together and building a sense of community can also be done through book clubs and movie clubs. And so those are some practical, very specific ideas, and just want to hear if you've done any of those at your organization, if you think that any of these are possible, simple things that you could do right away.
Yeah, we often get requests for book lists because there are certain books that we think are just so relevant for considering culture and health. For instance, The Spirit Catches You When You Fall Down. I don't know if I got that title right. Saganya, I think you know it. You might put it in the chat box. But that's like an awesome book to read and to understand how the influence of culture has impacted help seeking as well as treatment. So there are a lot of no-cost ways that you can think about bringing in retention strategies around celebrating diversity and inclusion. But again, this goes back to a comment I made earlier around just thinking about what's the time, the resources, and the space that your organization is willing to put into this. So we do know that like a lot of organizations and agencies now are developing like diversity, inclusion, equity committees, right? And so they're responsible for really thinking about leading and implementing different strategies within the organization. And that takes time. And so, and there's a lot of opportunity and creativity that you can bring to that. We were with somebody recently who just talked about these cultural lunches that they've been doing at their organization as a way to celebrate also the different cultural groups that are represented in their organization. So yeah, thanks, Saganya. She put in the right title. The Spirit Catches You When You Fall Down. I guess I wasn't too far off. Great book, though. Highly recommend using that as a potential launch for a way to have discussions about how this is showing up in your organization. All right, Annie, might go on to the next slide. I'll move it forward.
So we have 2 more performance areas. The next one is communication. And this means ongoing communication that shares your organization's mission, values, and policies, procedures, and the commitment to equity and cultural and linguistic competence. And it's ongoing because we really need to hear things over and over for it to sink in. So sample elements here are the policies and procedures about communication, translation and interpretation, and assessing needs and language preferences. Something to ask is your messaging about mental health across cultures culturally appropriate? As in, are you using non-stigmatizing language when you're talking about mental health? Also ask, how do your actions, behaviors, and space communicate diversity and inclusion? So for example, the physical space that we're in, do you have positive images of diverse communities in your office that make people feel welcoming from different cultures? How are you communicating the physical space that you are in? So, so just that communication is beyond just the verbal communication we use. Create a learning environment and hold space for difficult conversations. A lot of times people just don't feel comfortable to share. In a lot of conversations about diversity, people of color, might be the only one in the room. A lot of the white staff might feel uncomfortable that they're being targeted in these conversations. So you really want to create an environment where the sharing is open and giving feedback is not considered critical. It is just the way the organization works and operates, and people are supported in the communication that they share with each other. So establishing a culture where people can go to leadership or higher up without feeling like there's going to be consequences. Observe and appreciate generational differences. So one thing now with the millennial workforce surpassing the baby boomers, young people want things to move quickly. So a lot of times when they join an organization, they want to make change right away, but just being understanding of the differences and the way different generations work, that structural changes can take time. Also observe and appreciate communication styles of different cultural groups in the workforce. For example, which groups are more extroverted or introverted and how they prefer to communicate. So some people preferring to communicate in person versus through email or phone. Also be sure to check your own implicit bias and how your language and the words you choose impact others. Those are just some examples for communication and language support. Again, please go ahead and share. And I'm going to move into the last one so we have some time for Q&A. So the sixth performance area is partnerships and community engagement. Here we are talking about the relationship your organization has with partners, vendors, and the community. And do these relationships support and promote equity, diversity, and inclusion? The sample elements here, knowing the changing demographics, fostering relationships with culturally diverse partners and vendors, and then building capacity within the community to support organizational diversity, such as having an internship program. You want to build different pathways to work at your organization. So one example of how you can do this is organizing a volunteer program, especially for young people. So you can have young people start working in your organization, and then when they finish school, be able to provide jobs and opportunities for them. Also working with coalitions that are interested in the work that you are doing. And this is a great way to reach a talent pool that is representative of the community, reaching people who are already interested in the work that you're doing, and being able to eventually hire them on as staff. Create a policy that your organization will hire underrepresented groups for your contracts. So at the last organization I was with, we had a policy, specifically a vendor policy, that said that we were going to work with minority-owned businesses, women-led businesses, groups that were just underrepresented when we looked at who was printing our programs for our events, who was doing our graphic design and catering the food for our events. And especially for the catering of food, that allows for opportunity to have a lot more diverse cuisines when you're working with vendors from different cultural backgrounds, and not just, I guess, the traditional vendors that usually come to mind. So again, if you would like to share any ideas you have done with your organization around partnerships and engaging with the community. Let's move into the next slide. So once you've done this assessment, you can review your assessment as a whole. So your answers won't be a simple yes and no to these questions. You'll want to discuss as a group and identify where you have strengths that you can build on and celebrate those, and then where there's also limited, the areas that have limitations that need some more attention. Again, you may not be ready to tackle everything at once. It is a lot, like when you look at the tool and all the different aspects of it, you might decide to put everything into a plan or to prioritize areas that need to get done, and then just work on those specific areas. And just as workforce diversity is an ongoing process that never really finishes, so is this assessment process. It's not a means to an end. So you'll always want to be checking back and assessing how you're doing with your workforce diversity. So it is important to revisit your findings and continue assessing periodically, especially as new staff come on board and interact with the organizational dynamic. Okay.
Thanks, Annie. So we'd love
Sure.
to
So
hear
I wanted
from
to save
more.
some time for Q&A.
Yeah. We're at the Q&A portion of the webinar. We've shared a lot of different strategies with you. We'd love to hear if you have questions, or if there's a particular challenge that you want to explore while we're on. We're open to any of your questions at this point in the webinar. And one of the things that Annie kind of mentioned earlier is how this is a continual process. So would love to hear, like, maybe what are some of the changes that you're seeing in your communities or in your populations of service that you're having to consider as you also think about your workforce. I know there was a comment earlier about being in a really rural area. And so sometimes that can be a little harder in terms of how do you recruit and even retain just a general workforce. And then how do you think about it in terms of the workforce diversity and inclusion? That's certainly something that is a bit more challenging. There are other factors to be considering along with that, and oftentimes moving to a rural area is really different for communities of color because they feel more isolated and alone. So while you're thinking about questions, if you have any, and we're happy to do follow-up too, as I mentioned earlier, we do have a certain number of regional training opportunities and individual consultation available. So if this is a topic area that you might like to dive deeper into a little bit, please feel free to reach out to us. We have our contact information at the end of this presentation. We also wanted to just highlight that we do have an upcoming webinar coming up on how implicit bias affects the work we do in mental health and wellness. This was actually a training that I just did on site in Monterey, and it is a topic area that is a hot topic right now. So we're offering this introductory webinar, and also know again that this is one of those areas where if you are in a region and would like your workforce, like a large workforce group trained in this in a deeper way, this is also a regional training that we have available through our center. And so thank you, David, for sharing that note that yes, like bottom line often is the focus, and diversity is a little bit harder to add on when you're just trying to make ends meet. And like, where is the opportunity to think about points of change, those small steps that can be taken. So this is information on our webinar. If you'd like to register, the link is there. And also, here's our contact information. We are in our second year of our center's work. We're offering free training, TA, capacity building resources. So please feel free to reach out to us so we can explore opportunities with you. And finally, because we are funded by the federal government, we do need to request your feedback on a form. And these are really important to us, not only because it gives us input into our future events, so you have space where you're able to give us ideas on other kinds of opportunities or topic areas that we as a center could be focused on. We're also required to put it into our reports for our funder. And so this feedback form will appear up on your screen when the webinar ends. And a follow-up email will be also sent out following the webinar. Rebecca, thanks for sharing the comment on US AIDS United that did a free training for you on cultural humility. That is awesome. We're all about trying to find resources for many of the agencies and organizations that are looking for free resources. That sounds like another good one to look into as well. Also want to note that I saw that many people are from outside of our region, the Pacific Southwest region. But what's neat is that, as you found, anyone can access any of the webinars and trainings like that from any of the technical assistance centers. So you might find an offering that's being done in Michigan, and that looks good to you, even though you're living in Ohio, or maybe even further away, that example. But anyway, you can access services from any one of the TA centers, especially things that are done universally like this, a webinar. It's pretty easy. So anyway, thank you again for joining us. Looks like Saganya has offered a couple more opportunities and resources. Thank you again for joining us, and please do reach out to let us know how we can be of support to your agencies, especially in the Pacific Southwest region as well. So thank you, and I hope everyone has a great rest of your day. And Annie, you're on screen.
Thank you. Thank you, everyone.